Welcome back to National Report. The coronavirus outbreak has forced millions around the world to remain home and stay away from hospitals. But for some people, it's unavoidable.
Those with serious health issues like heart conditions, they don't have the luxury of postponing their doctor's visits. And one company emphasizing just how important remote patient monitoring is during a global pandemic like we're in today. Joining us now is Wasaq Al-Siddiq, the CEO of Biotricity. Good to see you. Your company is a leader in remote patient monitoring devices that are very important, used to diagnose high-risk cardiac patients. Can you explain what exactly your products do and how they work and why they're really so important right now?
Yes, and thank you for having me. So what we really focus on is real-time monitoring. A lot of the technology in the marketplace, when they talk about monitoring, it's actually recording and not actively monitoring. And so what our devices do is for high-risk patients, we monitor the patient, and anytime there's an anomaly, it basically falls into three kind of buckets. One is normal, the other one is urgent, meaning the doctor should be notified, but it's not an emergency situation, and then an emergency. And in the emergency situation, you can actually pull the patient, contact them, and say, yes, I need to do a procedure or an intervention. And for the urgent scenario or for the normal scenario, you know the patient is in control. So for high-risk patients that are worried about actually having an event, and when you have 2,200 Americans dying every day of cardiac disease, you don't have an option of not going and seeing your doctor because the option could be something catastrophic. So devices that are real-time, that are monitoring, that's really the future. And by utilizing a combination of telemedicine and real-time monitoring, these doctors are able to check in with these patients, keep them at home, reduce the risk of them getting COVID, but while also maintaining the quality of care and dealing with emergency situations.
Well, this sounds like an ideal solution, especially since we are forced to social distance from one another and rely more on technology these days. What's your product been able to do for people? Have we seen more people be able to, become aware of when they might be facing a real serious medical concern?
Absolutely. I mean, we are saving lives every day, and we've seen a lot of physicians really take a proactive approach where they're like, okay, we're going to control how many patients are in our waiting room. We're going to obviously follow the guidelines that, CDC has set out in terms of managing, but they're also using our device as a way to get these patients, tell them, pick up the device, we're putting it outside, we have your name on it, and just go home, relax. We're monitoring you. If anything happens, we will call you if there's a procedure required. And so that's allowing them to still keep that quality of care, still get the patient, back home and give them that peace of mind that if there is a situation, they don't have to worry and rush to the doctor. The doctor's going to contact them.
I think that's good that you said, peace of mind. We've got a lot of older generation out there that have to have these checkups. They have to go into the doctor's office. If there's a way around it, I know that they want to do it because every day they watch the news, they hear their demographic is more at risk to getting coronavirus. And obviously going to a hospital really isn't the best choice for them right now. So is there a big demand for remote monitoring products right now?
Yeah, so remote monitoring is basically exponentially growing right now. I mean, if you take a look at traditional, there's a lot of discussion around telemedicine and what telemedicine can do. The reality is telemedicine can only really deal with 25% of general cases because it's a video call. The monitoring and using devices lets you handle about 75 to 80% of cases. I mean, if you've got a patient with a cardiac issue, if you've got a dialysis patient that needs to be dialyzed more often, they don't have an option not to go to dialysis. So a video call doesn't really resolve that issue. Yes, you can check in with the patient to see if they're in control. So it's certainly a component that has to be there. But for those chronic patients, like you said, elderly, remote monitoring is exponentially growing right now. And I think it's going to be here to stay because I think the situation that we have seen is going to create ripples that will essentially change how we're looking at healthcare and how doctors are looking at healthcare in terms of managing patients and making sure that the quality of care is maintained.
Yeah, such a shift right now. That is the CEO of Biotricity, Wasaq Al-Siddiq. Good to see you. Thanks for joining us. Stay with us. We have more with National Report.